will go on and begin. Hope that everyone had a wonderful Thanksgiving holiday, and we want to take this opportunity to wish you a happy holiday season for the month of December and into January. We appreciate all that you do and are doing for your community and for your support of the data program here at GHA. This call is being recorded. The recording and the PowerPoint presentation will be posted on the GHA Data Services resource page in the next week or so. So if somebody has missed the call or needs to go back and listen to something, that will be available as well. Please keep your microphones muted unless you have a question, and please feel free to unmute yourself and chime in at any time. Also, we are monitoring the chat box. If you prefer to ask a question or give a comment that way, Sharif and I are monitoring the chat box as well. Our agenda is fairly brief today, and we'll be talking about our normal topics, the GDDS overview. Again, Sharif is going to review the data validation and error review, and we've kept that on the agenda because it continues to be a topic that needs to be addressed as people continue to submit their data, and as we move into the we'll be beginning the fourth quarter data submission for 2021. So we want to start that process of validating that and reviewing the 2021 data before we get into 2022, which won't be very long at all. Also, we have a users update, we have patient safety culture survey update, and a member folder update. The Georgia Discharge Data System, for anyone who is new or may need a review, is we are the state vendor for this program. By law, the state requires hospitals to submit their inpatient and outpatient data. And again, we are the vendor for that. Hospitals submit their data through our vendor, HIDE, which is a subsidiary of the Missouri Hospital Association. That data is submitted in the UB04 format, and Georgia has a specific format. And I mention that because if you happen to switch your billing vendor internally, we have a specific UB04 format that they will need to make sure they program your file, your output file, to be submitted to HIDE in that format. And we can work with you one-on-one on that. Once that data is submitted to HIDE, you are provided with edit reports and verification reports, which Sharif will give a brief overview. And that data is processed. It is also assigned codes such as DRGs. It is also grouped into service lines. It is taken through over 100 validation points, edit checks. And then that data is provided back to GHA, where we provide it on your behalf. We submit it on your behalf to the Brain and Spinal Trust Fund Commission, to the state. And then we also participate in the Agency for Healthcare Research and Quality and the Healthcare Cost Utilization Project. And those are entities that help us manage any research requests, and they vet those for us. And once they pass that initial vetting, they are sent to us, and a team of 3 reviews those and gives final approval for a researcher to obtain that de-identified data. And I'll go back one more. But the purpose of all of this is that then we in turn provide you access to this data through our strategic planning module, the visualization tool that is currently powered by JVION, and the readmission tool. If you need to add new users to either one of those tools, contact myself or Sharifa, or those forms are also located on the GHA Data Services member resource page. And that allows you a history of about 5 years of data at the aggregate level, and you can see the entire state worth of data to do any strategic planning you may have. This is our schedule for 2021. Our next meeting in January will have the 2022 schedule. I think everyone's on a pretty good rhythm of their data submission. in our monthly submission, which we greatly appreciate. Just a couple of data updates. We have closed Q3, and we delayed that a little bit. We thought we were going to have to delay it even more because we had a large system who was upgrading their system to Epic, and Sharifa worked diligently with them really over the last quarter to have that data testing, data submissions and monitoring the error rates and adjusting and making tweaks here and there with them. And so they worked really, really hard to get all that data submitted. And we initially thought we might have to wait till mid-December to close Q3, which is, several weeks off our normal timeline, but they worked really hard to get their data in, and Sharifa supported them. So we were able to close a little bit late. So we will be, having that data integrated into the strategic planning tool. I do have the deliverables for the limited data set. However, we are having an issue with our, the portal, the cloud portal, which we use to distribute that data, Box, not Dropbox, but Box, which is a HIPAA high-tech compliant portal where we can securely give you access to download that de-identified patient level data for those of you who subscribe to the limited data set. So we have a ticket in with Box. Our IT is working on it, and it's affected GHA organization-wide. So as soon as that issue has been resolved, you will be receiving notification from me that that data is available. Any questions? All right. Sharifa, I'll turn it over to you to talk about data submission and verification.
Thank you, Leslie. Good morning, everyone. And this is the landing page that you're seeing right here for HeidiNet. And some of you don't have access to that, but I guess two of you should have access per facility to this so that you can submit data. And it's the V3 website, the version 3. So make sure that you're still using that. I've heard of a few people still using the old site. So make sure you're using that new site. If you need it, I can send it to you to submit your data. And so that's where you would upload that UBO4 file. If you go to the next slide, and then under the report section, after you upload the file, there'll be a few reports that are generated, including an edit summary report, which you'll get an email of, and then a verification report, which is a good resource to review the data you submitted as a whole. And then, of course, the edit detail, which is a detailed version of the edit summary for your fatal errors. So it shows you which records have those errors. So you can go internally, make those corrections, and then resubmit through that site. You go to the next slide. So this is a snippet of the edit summary report, and it shows you an overview of your errors. The fatal errors is what causes that your fatal error rate to go up, so above that 3% threshold. And then you have warning errors also, and then I for informational errors, but those don't count towards that fatal error rate. But you can still look at those and review those. If you see that there's something that's trending or where there's a high number of warning or informational error, you can also look at those if they're associated with the fatal error rate and make those changes. And so for this example, you see that the primary payer is missing. So then the 4 records that have that issue, you would go into the edit detail report and look at those, and you can look them up by medical record number and patient information, which is why it's not emailed to you, it's on the website. So one of the uploaders or users who have access to HeidiNet would be the ones who be able to access that. And then you can share it within your appropriate, I guess a secure email should be sent because it does contain PHI, like I said, medical record number, patient record number, date of birth, etc. And so that edit detail report is what you should use to make those corrections.
And the edit detail report will only show the records that have a fatal warning. Now that record could have a fatal warning, but it also could have informational and just warning edits, and those will be identified as well, but it would only show those records that have a fatal warning.
Yeah, there's no list of just the warning. Some people have asked about those, but it only shows the ones that are attached to a fatal warning or fatal error. Any questions about that? And thank you for all of you who have been using these, and asking questions. You can always, if you have a question about an error or why it's showing up, usually we can contact Heidi. The programmers are able to kind of look deeper into the data and they can run like a sample report for you to show you, the reason why this error is happening. So it gives you a better idea on how to make those corrections. So feel free to email me if you have any questions about that. And another, I guess, major component of submitting data and making sure it's correct and valid would be the bill types that you use to identify the patient type, so inpatient, outpatient, emergency, etc. So I just wanted to go over how to use those correct bill types to make sure that your data is accepted. Because if not, it won't count towards your total, record count. And you can do that through Heidi as well. So when you're in Heidi, under your data submissions tab, if you select the submit ID, I guess number, it usually starts with Georgia and then a number is generated. You can see what was submitted in the different patient types or bill types that were used to categorize those records. And so for 111, for example, is inpatient. And if you're using another type of bill type that's not accepted, it'll show as an invalid bill type or a bad bill type, and that will be dropped from your overall population. So always make sure to check that to make sure that your population count is correct, and then you can go in and make sure the bill types that you're using are correct. And sometimes it's just missing a 1 or there's a space there, or you're using a 0, so sometimes it's a pretty easy fix. You just want to catch it early so you don't have to do, like massive corrections. And you can find the patient type definition form under the the documentation section of the Heidi website. And it shows you what bill types are accepted for each, for each patient type. So inpatient, there's swing bed as well, which should be separate, so that they should use a different MPI as well. And so those are the bill types here. And you can also find that under our data resources section on our website. We have that patient type definition document for you. I was saying about swing beds, those under the verification report show separately. So you want to use the proper bill type as well as a separate MPI number to identify those. And this is also so that we can separate them from your data file. For those of you participating in Quality Works, those are excluded. So you want to make sure that your swing beds don't fall into the overall inpatient population. And then you can see that for those who have swing beds in the verification report on page 3, it shows you how many swing beds you have. And so I review those pretty frequently. So I'll let you know if I see any major changes, or maybe you're not providing as much swing bed, as many swing bed services in your facility. And so it's good to let us know too, so that we can include that in our notes of the study if the numbers have dropped drastically. And so that verification report is a good report to use to verify your data. And that's all I had. Any questions?
All right, thanks, Sharifa. Just want to go over real fast and tell you about the new member reports that we are putting into the member folders right now. There are 5 reports, and then one is a reference guide. So there's 5 individualized reports for each hospital. I want to call attention to a couple of them. The cost report model is just what your hospital had and your most recent cost report data. That Amy's does this for us 2 times a year. So this would have been their Q2 download of all the cost report information. So that would be there for you to to make sure that what's in there and what CMS has is accurate for you. 3 of them, the critical access hospital and small rural utilization, the financial indicators analysis, and the readmission reduction analysis are in their new BI platform. So they're highly interactive and got a ton of information on there. The critical access hospital, and really it's all rural. You can break down by the individual product lines, and I think there's 7 or 8 endocrinology, hematology, urology, and some others that are in there that you can break down by your inpatient fee for service, case mix, charges, and give you a comparison of you for against other rural hospitals across the country for each one of those different service lines. So it's a really good information for the rurals. There's an outpatient procedures as well. I think it's some ED and some pathology type of drill downs that are in there. The other one that's everyone is the financial indicators analysis. This used to be one that was in their the old PDF format, and I think it ended up being like a 60-page report. So they have a ton of indicators. There's some profitability indicators. There's some liquidity indicators. I think one of them's got capital structure in there. So, you know, you've got your average payment, your current ratio, days of cash on hand, your EBITDA, the operating margins, total operating margins, things like that. So it is a wealth of information, and there are a number of different ways to make different comparison groups in there. So you can compare yourself against all hospitals, rural PPS, urban PPS, non-teaching, and then there's some that are specific for your basic size of hospital. The readmission one is actually the one that was also done before in their the old format with the PDF, and it was a very long and tedious one to look at. And it's got your actual performance for years, the last couple of years, condition-specific revenues, based on all of the different discharges, the conditions, let me just pull one up. It's the adjustment factors, the estimated revenue. So it's a really good tool, and you can drill that down into each one of the different readmission reduction programs. So I would encourage you to go into the folders and download your hospital's reports, because there's a lot of information there, and you can really drill down specifically. The last one, and I think this is on the next slide, is a screenshot of the reference guide. So this is just a PDF that's in everyone's folders, and it's got all of the different algorithms that are used for each one of the different quality programs. So that's a great resource to use. It's the 2022, 2023, and 2024 program. So you know, if you ever had a comparison of what you had versus what this has the actual algorithms that are in there for you to maybe even calculate your own and see if it compares to what CMS has. So not all of it. It takes a little while to post the BI tools. There's a bunch of information there in this HTML, so it takes a little while to post those. So we're posting those. I would think they'll be up probably by the end of the week. So just make sure you go in and get those. They're great resources for you for 2022's efforts. Be more than happy to take any questions on those. All righty.
There's this question in the chat.
Yeah, I was gonna take that at the end, if that's okay.
Oh, okay.
Thanks, Sharifa. If there aren't any questions, just a reminder, these member reports that we do on your behalf, we subscribe to these reports that are generated by a vendor that we use, and we generate these on your behalf annually, and we have for the last decade or so, Bill, I think, if that's correct. Yep. So they're a great resource as data submitters and users. This, you may want to make your finance team aware of all these. They do get notification that these are available to them, but it is important and valuable information that a team at your hospital should be reviewing.
And these will be available by the end of the week on the website.
Okay, great. Did want to bring your attention, we mentioned it on last month's call, and since then we have sent an email out to many of the quality contacts at your hospital. GHA does partner with a vendor, the Center for Patient Safety, on the Patient Safety Culture Survey, which is submitted to AHRQ and to the national database. So that includes the hospital survey and additional add-on surveys such as the medical office, pharmacy, nursing home, emergency room, and I think there may be a couple other, but we do offer that, and we have been able to continue our relationship with the Center for Patient Safety, and we have the opportunity to purchase in bulk surveys for 2022. So two things: we put out this email with a link to kind of gauge where your facility may be in taking a survey, conducting a survey in 2022, so that we can offer those kind of early birds the best rate possible, as well as we're offering a demonstration presented by the Center for Patient Safety next Wednesday at 10 a.m. And you can register for that on the GHA website. And if you would like me to forward this email to you regarding the patient safety survey, because you may or may not have received it, we did focus it on our quality contacts at hospitals. I'd be glad to forward that to you if you just want to either send it in the chat that you would like to see it, or message me, email me individually. That would be fine. I'd be glad to forward that to you. But it is a valuable service that we have offered for quite some time. And the services that the Center for Patient Safety offer, the reporting, they have improved those. So we're excited for that in 2022. And I wanted to address a question we had in the chat, which was when can you expect to receive the GDD invoice for 2022? Bill, correct me if I'm wrong, but we should be sending those out by the end of January.
Yeah, that's correct. First quarter.
First quarter.
Yep.
Are there any other questions about anything data services offers? Okay. Here are the user group meetings for 2022, and I'd like to bring your attention to the fact that we have moved the first two meetings a week later. In January specifically, we did that for the Patient Safety Summit, which some of you attend. I will be attending. So that was a conflict with that first week of January. So we've moved that to January the 12th. And again, you'll receive an email about that. And then because we moved January 12th, we decided to bump back February's as well, so they weren't so close together. So February 9th will be our February meeting. And here is our contact information. If you need any information, if you need training for your team or have a question on how to access something on either the submission platform or our strategic planning platform, please let Sharifa or myself know. We'll be happy to work with you so that we can set up an instant meeting to work with you online. Again, any user requests can be directed to Sharifa or myself, and those forms are on the GHA website under data services. So just please let us know how we can support you and help you. And again, we thank you so much for all of your diligent work in maintaining an even keel on the data submission during this pandemic over the last really 2 years. So we appreciate that very much, and let us know how we can help you. So again, happy holidays, safe holidays, and we look forward to seeing you in 2022.